Hello, this is Dr. Grande. In today's video, I'll be covering 5 myths of post-traumatic stress disorder, otherwise known as PTSD. If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss any new videos. So let's jump right into it with myth number 1 about post-traumatic stress disorder. Myth number 1 says that any event can count as a trauma when diagnosing post-traumatic stress disorder. Now, I think part of this myth has this idea of over-pathologizing, that the DSM is really too broad and pretty much any event can count as a trauma in the definition of PTSD, therefore PTSD is diagnosed too much. Actually, if we look at the qualifying trauma area of the definition of PTSD in the Diagnostic and Statistical Manual, we see that it is appropriate in terms of what types of events can count as a trauma. It's really not too broad in my opinion. Now, for an event to count as a trauma, it must be related to actual or threatened death, serious injury, or sexual violence. Now, within that framework, it also has to meet one of several other criteria. So somebody can directly experience a trauma, they can witness a trauma in person, they can learn about a traumatic event that happened to a close family member or a close friend. Then we get to the last criterion, which is repeated exposures to aversive details of a traumatic event or an extreme exposure to aversive details of a traumatic event. So really, when we look at the qualifying trauma definition, certainly any event wouldn't qualify as a trauma with PTSD. Now, myth number 2 is that with PTSD comes a higher risk of violence. Now, in order to understand why this is a myth, you really have to understand that PTSD oftentimes does not occur in isolation of other mental health symptoms. Particularly substance use disorders seem to co-occur with PTSD. A lot of times we think the PTSD symptoms come about first, and then as a way of managing those symptoms, sometimes people turn to substances. So when you look at PTSD as a whole, yes, there is an increased risk of violence with post-traumatic stress disorder. But when you control for other comorbid mental health disorders like substance use disorders and other mental illnesses, PTSD doesn't carry any increased risk of violence. Myth number 3 is that when a traumatic event occurs, the symptoms are always immediately evident. Now, we know that sometimes the symptoms come about fairly quickly after a trauma. There's even another disorder, acute stress disorder, that's really designed to deal with these symptoms. For an individual to have post-traumatic stress disorder, the symptoms would have to be present for 1 month or more. Sometimes, however, the symptoms do not come about quickly. Symptoms of PTSD can occur months after a trauma and sometimes even years after a trauma. This is called delayed expression. And even though it's not particularly common, we do see it once in a while. Most of the time, of course, we do think of the symptoms as occurring within about 3 months of when the trauma occurs. Myth number 4 is that traumatic exposure through television or pictures doesn't count as a qualifying trauma. Now again, this goes back to the definition of qualifying trauma we see in the DSM. And most of the time, when we think of this criteria, we think of work-related, really secondary traumatic stress. Secondary traumatic stress isn't a separate mental health disorder, but it's the phenomenon that we're referring to when we talk about repeated exposure to details of trauma or an extreme exposure to details of trauma. So we talk about exposure to traumatic events through the electronic media like TV, pictures, or movies. Only work-related exposures would count as part of this definition. So as far as this myth with traumatic exposures through TV or pictures not counting, when they're work-related, they would count. Myth number 5 is that a diagnosis of PTSD can occur immediately following a trauma. So this is somewhat similar to myth number 3, with the trauma symptoms being apparent right away all the time. Now, I mentioned when I was talking about that there's another disorder called acute stress disorder. When we see symptoms of PTSD immediately after a trauma, oftentimes we're looking at acute stress disorder and not post-traumatic stress disorder. By definition, as I mentioned, a diagnosis of PTSD cannot be given until at least 1 month after a traumatic event. I hope you found this description of 5 myths of post-traumatic stress disorder to be interesting. Thanks for watching.